Hi, my name is Josh, and I'm an occupational therapy graduate student. In this video, we will discuss how to properly set up a workstation, the most common injuries that occur in a workstation, and some ways to prevent these injuries. First, let's start off with the basics. The essential elements of a workstation include your chair, your desk, your keyboard and mouse, your computer monitor, and the lighting. Now, depending on your job, you might also have some accessories such as a stapler or a document holder, so we'll also discuss the proper placement of accessories within your workstation. First, we'll look at the chair. The more adjustable features, the better, but a typical office chair will have a 5-caster base, a lever to adjust the height of your seat, an adjustable backrest, and possibly arms. It is recommended to have a 5-caster base rather than a 4-caster base because it improves maneuverability. Your seat height should be adjusted so that your feet are flat on the floor and your knees are at a 90-degree bend. If your feet cannot rest flat on the floor, it is recommended that you use a footrest. A binder will do just fine. Moving up the body, your hips should also be at a 90-degree angle, and so should your elbows. If you have armrests, adjust them so that your elbows are supported at 90 degrees and position them close to your body. This should place you seated upright in your chair. If you have an adjustable backrest, you can adjust it up and down or forward and backward to ensure that you are utilizing the low back or lumbar support. The lumbar support is important to keep your muscles in your back from getting tired. If your chair has poor support, you can use a pillow or a rolled up towel for added support. Our backs are naturally curved, and it is important to keep that curve. If your chair lacks padding on the seat, you can use a cushion or a pillow because a hard seat can cut off the circulation in your legs. Now let's look at your desk. Some desks are adjustable, and if so, should be adjusted so that you can work on them with your elbows at 90 degrees. Your desk should also provide adequate room to work at and enough leg room so that you do not have to turn or twist. Your mouse and keyboard should be able to be used with your elbows at 90 degrees as well. If your desk is too high, you can use a keyboard or a mouse tray which is installed underneath your desk. You should not have to reach far to use your keyboard or mouse. The closer your arms are to your body, the less energy is needed to sustain that position. So your keyboard should be close to the edge of your desk and your wrist should remain straight, not bent up or down, because this will compress the nerves running through your arms and can provoke discomfort or injury. Cheap gel pads or a folded towel can be used to help keep your wrists neutral. Your monitor should be roughly an arm's length away from you. Having a monitor too close or too far can cause eye strain. Brightness and contrast should be adjusted on your monitor to further reduce eye strain. The height of your monitor should be adjusted so that the top of the screen is within 2 inches of your eye level. Lastly, your monitor should be positioned straight in front of you. Let's talk about lighting. The 3 areas to consider are quantity, contrast, and glare. You want to have adequate lighting for the task you're working on, not too much or too little. It's important to understand that different tasks require different amounts of lighting. Consider the amount of light needed to comfortably complete the task without straining your eyes. Adjusting the lighting contrast by turning off background lights and reducing glare by closing your blinds in the middle of the day. It is beneficial to have a variety of lighting so that you can select the ones to use for any given task. A good combination would include low glare overhead lights, direct light from a window, a task light, and indirect lighting. When using task lighting, try to keep it under you, not above you. This way it does not create shadows. Other quick fixes to prevent glare include repositioning your computer, wearing a baseball hat or visor, and installing a computer screen filter. When setting up accessories, there are 3 zones of your desk: the front, the middle, and the back. Keep items used frequently in the front row so that they are easily available. Items you use intermittently can be placed in the middle of your desk, and items used rarely should be placed at the back or above your desk. It is important not to overstretch or reach for items far away. The appropriate way to reach for these items would be to stand up first and then reach to obtain your item. Avoid reaching far above your head, because this is not good for your shoulder, and sometimes a step stool is more appropriate to reach high areas. When using a telephone, do not hold the phone by pinching it between your head and your shoulder. Instead, use a headset. That wraps up the basics in workstation setup. I'd like to finish up by going over the most common injuries, what causes them, and ways to prevent them. In no particular order, the most common problems seen are with vision, hand or wrist pain, neck or shoulder pain, low back pain, hip or leg pain, and elbow or arm pain. Vision problems can be caused by lighting or improper distance between you and your monitor. These problems can be countered by adjusting your lighting, moving your screen to an appropriate position, and then following up with a visit to your eye doctor. Hand and wrist pain is often due to improper mouse and keyboard placement or usage. It is vital for your wrist to be flat or neutral while working. Working with your wrists cocked up can cause pain by compressing the nerve canals in your wrist. Also, while using your mouse, too much wrist movement will cause pain. You should operate your mouse by moving your whole arm from your shoulder, not isolating your wrist. Neck and shoulder pain can be caused by bad posture. This happens when your computer screen is too far away or not placed directly in front of you. To correct this, gradually move your monitor over the span of a week. This way you can help bring your neck back in line. Low back pain is most likely due to a lack of lumbar support, so roll up a towel and stick it behind you to help support your back and keep its natural curve. Hip or leg pain can be caused by a lack of leg space, poor circulation, or an off-balance pelvic tilt. To start, make sure there is an ample amount of space under your desk for your legs. Next, make sure you are properly adjusted in your chair. If you sit on the edge of your chair, you can be cutting off the circulation of your legs. Crossing your legs also cuts off your circulation. If your hips are hurting, adjust the tilt of your chair if that is an option, or adjust your sitting position. To summarize, I'm not telling you to sit perfectly all day. The key is adjusting your position often, before your body tells you to. If you feel pain, respond to it and make adjustments. If your pain is intense or continues, it is always recommended to see your doctor. Thanks for watching.